Hi, my name is Karen O'Toole. I am a clinical research study coordinator with the Breast Cancer Family Registry, and I'd like to introduce Dr. Saundra Baez. She is the chief of the Division of Oncology of the Huntsman Cancer Institute and a professor in the Department of Medicine at the University of Utah School of Medicine. Dr. Baez is a warm, caring, extremely knowledgeable, and has cared for patients with all types of cancer since 1982. She specializes in breast cancer and is co-leader of the Metastatic Breast Cancer Support Group. So welcome.
Thank you.
So what is one of the biggest challenges in your field right now?
There are several things that come to mind in terms of big challenges. One big challenge is, I think as we learn how to treat cancer more effectively, one of the important questions is, who do we need to treat aggressively and who do we not need to treat aggressively? So I think one big challenge is just figuring out how is this particular cancer likely to behave. So I think that's one important thing. Another important thing and a big challenge is trying to figure out how to use all of these new great targeted therapies that are so expensive. So I think that trying to deal with the cost of medical care in this particular time is a real challenge that we all have to face as individual providers and as a society. And then, of course, a more immediate and recent challenge is the pandemic and the need to wear masks with patients and the difficulty of communicating and re-expressing yourself and seeing their full emotion if they're wearing a mask. And then, of course, it's been difficult for patients because often during this pandemic, they haven't been able to have family members there as much as they would like. So that's been difficult. But those are some of the things that come to mind. Everything from the diagnosis to the treatment to the psychosocial aspects of managing cancer, I think are challenges.
Wonderful. How has clinical oncology changed since you began working in the field?
I think that medical oncology has not changed in some really crucial ways. The way it's not changed is that it's still really important to present all the options to help people make good choices for themselves, to express honesty, but still being compassionate in the clinical arena. So I think that the real basics haven't changed. Some of the things that have changed are just a whole new spectrum of cancer treatments and a whole new spectrum of ways of trying to detect cancer early. So we used to have mammograms, but now we've got MRI scans. We used to have CT scans, but now we've got targeted ultrasound that can be done through a scope through the intestines. So there are a lot of new techniques that can be used and a lot of new treatments. One of the really interesting things that's happened is trying to figure out how to use the body's own immune system to help treat cancer. So 10 years ago, 15 years ago, there really was almost no immune therapy for cancer. And now 30 to 50% of cancers have some possibility for immune treatment. That hasn't really panned out very much in breast cancer, but that's one of the things that has really changed in all cancers, I think, is targeted therapies, targeted to the immune system or targeted to specific proteins on the cancer, such as HER2 proteins. So those are some of the ways that cancer treatment has really changed.
Very interesting. How has research contributed to these changes?
Oh, research is so crucial in cancer management. So the only way we've really learned anything about cancer is through studies, through studying people who are at risk for cancer, through studying people who have cancer. So research is really crucial. Only about 1% of people with cancer go on clinical trials to try to look for better ways of treating cancer. and a smaller percentage go on studies like the Breast Cancer Family Registry, where we're looking at the risk factors for cancer and what things might be associated with a reduced risk for cancer. So it really is crucial. There are other ways to learn things about cancer. We can look at big databases, but it's really the individual being willing to enroll in studies that has made the biggest difference in cancer treatment.
What do you think or hope will change in the future with new research findings?
Well, I think we will be able to more carefully predict who is likely to get cancer. And that's where some of these studies of genetics and lifestyle factors come in. I hope that we will be able to more accurately predict how a cancer is going to behave. And therefore, we will be able to decide, is this treatment necessary, or is this treatment all we need? Or maybe they don't need treatment at all. And then, of course, I hope that we can figure out ways to treat cancer in a more cost-effective way. Cancer treatment is really expensive, and it leads to a lot of financial hardship for people and for society as a whole. So I'm really hopeful that we'll be able to figure out better ways that will end up being, I hope, cheaper to treat cancer effectively.
Okay. Why is participation in cancer research so important, especially participation in the Breast Cancer Family Registry?
Yeah, good question, Karen. As I've already said, participation in research is crucial because that's how we learn anything new about cancer detection or prevention or treatment. And I think that it's particularly valuable to have individuals join in registries and research studies like the Breast Cancer Family Registry, because what we really hope to do is to be able to figure out what are those early stages of cancer development, whether that's a genetic change or whether that's a lifestyle factor, and then figure out how to intervene early in that process to reduce the risk of getting cancer. So we're really looking now in cancer at both ends of the spectrum. We're looking at the final cancer and saying, what is it about this cancer that is going to allow us to predict how it's likely to behave? What is it about this cancer specifically that will allow us to use treatment that will be most effective for this cancer? And then at the other end of the spectrum, what are the specific genetic or molecular changes that can help us predict who's likely to get cancer and maybe reverse some of those changes? So cancer is really in a very interesting place right now, where we're looking at these really earliest phases and we're looking at the end stage of cancer and trying to figure out how to best use our powerful tools to intervene at each of these steps to make the biggest difference for individual patients and populations of people as well.
So we have a new young women's study in the Breast Cancer Family Registry. Why is this study so important? What do you think?
Yeah, and I think it's really important because, as I mentioned, we know that cancer is a very long process. So it's probably many, many years from the time a cancer first starts, that genetic change or that change in the environment of the cancer cell. It takes a long time between that initial event and then many subsequent events to eventually being diagnosed with cancer or that first identifiable cancer cell. And so we want to start looking early in that process at younger and younger people to try to figure out what it is that's gone on that increased the risk for cancer. So one of the really interesting things we're doing in the young women's study is to try to look at things like, well, even intrautero development. What are the things that can be important even during pregnancy, not only the woman who is going to then get breast cancer, but the infant who is in utero and is developing? Are there things that pregnant women can do to reduce that initial step of their offspring to get cancer? So I think the focusing on the younger women is really an important part of what we're doing in the breast cancer family registry.
I agree with you. What are the most important or key things you tell your patients?
Oh, well, I tell them a lot. I probably over-educate them. But for most cancers, I think one of the important things is to know, and I'll just use the example of breast cancer. So for my patients who have breast cancer, the couple of things I tell them are, number one, breast cancer is really common, and it happens independent of anything that you've done. So this is not your fault. So that's one important thing that I tell them. And the second important thing, I think, for people with most cancer, and particularly breast cancer, to know is that most of the time when you get breast cancer, you're going to be cured of it. Most of the time, there will be some very effective treatment, whether it's surgery alone or surgery and radiation or chemotherapy or endocrine therapy or targeted therapy or whatever. Most of the time, you'll be cured of it and live a long and good and healthy life. So those are two things that I think are really important for women to know. You didn't cause this, and it's likely that you're going to do very well. And of course, we have to also mention the possibility that some women don't do well. Some women are not cured. Some people are not cured. But most of the time, if it's breast cancer, they will be. And I think that's an important message.
In terms of actionable lifestyle changes, cancer prevention, etc., if you wanted to communicate one thing to the general population, what would it be?
I think the most important thing for the general population would be exercise, physical activity, and diet goes along with that. Typically, they go hand in hand. But I think that people who are really active, number one, they're less likely to get many kinds of cancer. Number two, at least with some of the cancers, if you avoid weight gain, if you stay active, there's a lower likelihood of cancer coming back. And the third thing is that if you're physically well, then no matter what kinds of treatments you have to go through, it's going to be easier if you're physically well. And it's going to be easier for you to get back to that same normal, good, healthy person that you were before you were diagnosed with cancer. So I think that the things that are really crucial, I think the lifestyle of physical activity and then a good, healthy diet. I think that's what I would say are the most important things.
Wonderful. Can you think of anything else you'd like to add?
I guess I would just like to say that we appreciate so much individuals who are willing to participate in the Breast Cancer Family Registry and other similar studies. It's so valuable, and it makes us know that no matter what else is going on in the world that's hard and complicated, that there are people who really are altruistic, care about each other, and are really pulling together to do the best they can to help each other and to help us figure out ways of reducing the burden of cancer that we all share. So thank you so much.
Thank you, Dr. Bies.
You're welcome.